a couple of minutes. First, want to make sure that I thank and congratulate Los Angeles Christian Health Center for their remarkable success on the Joshua House and opening up their clinic and making a significant impact in the community, as well as being a leading example to other organizations like theirs or similar to theirs. So looking forward to not only seeing what they do, but also seeing maybe in some other communities some of the momentum that's been created here that can be replicated in elsewhere. And so very excited to hear from them. I think everyone knows the overall economy and Christian CDC guidelines have been lifted. So the slow acclimation back into full business, business operations and moving forward is going to be key. So we're working through that as an organization. We're working through that with our residents, our employees, and our partners, and also trying to make sure that we take lessons learned and also implement, successful practices, in an environment such as ours, so that we can continue to be successful during a very difficult time, both in Los Angeles around homelessness, and then also just, again, a post-pandemic transition back to what would be the new normal. And with that, I'm just going to invite everyone to come onto video, and I'm going to start introductions with everyone. Very, very excited, to introduce this lovely panel. They're extraordinary leaders, they're extraordinary women, they're extraordinary influencers, and I mean influencers in kind of the old school way, and just making sure that, that the impact that they make in the business environments and organizations that they have is really noteworthy and notable. I want to introduce Dr. Lisa Abdishoo. She served as a president and CEO of the Los Angeles Christian Health Center since 2012, overseeing all of the day-to-day operations of the organization, including clinical and administrative services. She obviously has a passion for expanding access to healthcare and using it to create pathways out of homelessness that has fueled her work at LACHC for over 20 years. She started in 1997. She rotated through a very small homeless clinic. It was known as LA Mission Community Clinic at the time, and as part of her Cedars-Sinai residency outpatient experience. In 1999, she came on staff as the clinic's first physician/medical director. And in 2004, when the clinic split away from its parent organization, she became the founding executive director and medical director of the new entity. Dr. Abdishoo received her undergraduate degree from University of California, Irvine, and graduated from the University of Southern California School of Medicine. She completed her residency in internal medicine at Cedars-Sinai Medical Center in Los Angeles, and she is board certified in internal medicine. She's also, just like I said, an extraordinarily influential leader in the community, not just the immediate community that everyone knows her for, but the community at large, and really proud to know her, myself and the organization, really proud to even kind of be in her presence at times. Shannon Fernando is a California-based board certified family nurse practitioner. She joined LACHC in July 2013 and currently serves as the Chief Innovations Officer, previously as the Associate Clinical Director. As CIO, Shannon oversees and manages special clinical programs, including the street medicine teams and hepatitis C treatment programs, whole person care, and clinic-wide advocacy efforts. Shannon also engages in direct patient care and assists the CMO in running the medical department, recruiting advanced practice providers, managing the medical providers' schedule and education, and serving as a liaison with the operations department to improve medical care flow at all sites and supervising the clinical satellite lead clinicians and providers. She's also the founder and president of Alabaster Mobile Clinic, which is a nonprofit organization which provides health services and health education to impoverished rural and urban communities in Africa. and founder and chair of the LA County HCV Provider Work Group in collaboration with the Community Clinic Association of LA County. Very excited to have Shannon here. You know, obviously by what you heard, another powerful influencer, not just in the local community, but the community at large, you know, really making significant impact and roadways into how things should be done, you know, why things should be done a certain way, and just the overall commitment and delivery to people that really, really need the services. So again, don't want to, I always use the word influencer because everyone always goes to social media, but this is like old school influencing, you know, where it's just just remarkable work on her behalf. And the amazing Teresa Winkler, she's a Skid Row Housing Trust who currently resides at the Abbey. A lot of people know and love her. You know, prior to finding her home at the Trust, she lived on the streets for over 25 years. Some of you have heard her story, but she's a success story as a woman, as a formerly homeless individual, and just a leader in her community. Today, she is a public speaker and advocate on the local, state, and federal level for permanent supportive housing and health services. She's also a Los Angeles Christian Health Center patient, so she has a very unique and rounded out perspective that she experiences and continuously shares for the advocacy of others. So with that, I'm just going to go ahead and get the panel started. So again, ladies, thank you for attending today. Thank you for participating today. It's remarkable, it's lovely, it's wonderful. Congratulations to Joshua House. We participated in the virtual grand opening, and it was really extraordinary to see the stories, you know, so glad to have you here today. So Dr. Lisa, which is Dr. Abdishoo, and I know a lot of people call you Dr. Lisa for those in the audience that may or may not know. Really proud to have this partnership, you know, with you. And I know that you have a lot of not just academic knowledge, but, you know, subjective and experiential knowledge as well on why bridging housing and healthcare together is so important. Can you expand on that a little bit? Can you give your perspective on why that model works and why that might be a model that could be repeated in the future?
Yeah, definitely. And thank you so much, Lee, for the kind introductions, and we're glad to be here with Skid Row Housing Trust today, and you know, grateful for our partnership as well. And yeah, you know, I would just say that connection between housing and healthcare is so critical on a lot of different levels. And you know, I first kind of look at it as on how it doesn't work when we're sort of separated in silos and when we don't have that connection. So basically, when if we have a patient on the medical side or the clinical side who's living on the streets or they're in and out of shelters and there is no connection to housing, you know, we can treat their medical conditions, and it's important that we try to do so, and we can make some progress. But in a lot of ways, we'll be fighting a losing battle because, you know, while being on the streets, they'll have difficulty keeping their appointments or keeping track of their medications or, you know, prepping for a procedure or recovering from a surgery. And they're going to keep getting exposed to infections on the streets or to trauma and just all the things that go along with that life of being unhoused. And then similarly, if we assist somebody to get into housing, but there's no linkage to healthcare, then their condition can actually deteriorate because they may become isolated and they're not getting the mental health treatment that they need or the substance use treatment or the care for their chronic diseases. So that, you know, being in housing without healthcare, you know, also is just, it just misses the mark. And so, you know, what we've learned is that when we can make the flip side of that happen, we can bring healthcare and housing together, that so many amazing things can happen. And it can look a lot of different ways. The intersections are many, but you know, it can be where we have care coordinators on the clinic side helping to link people into housing, or helping them retain their housing by continuing to work with them once they're housed. Or where you have case managers on the housing side who are making those strong linkages to the medical and dental and mental health and substance use services on the clinic side. So, those can look a lot of different ways. And one thing that we love is physically bringing the two together, because that can just make it happen in an even more seamless and beautiful way. So like what we're doing in our Joshua House and 649 Lofts project, where we're completely co-located in that same building. And we've just found that facilitates so much recovery and healing to happen. So I probably said enough, but that's we think about this a lot, and we've learned so much about this over the years.
No, I think it's really key the way you outline that, because oftentimes when you're not feeling well, you have to go somewhere to rest and recover. And if you don't have somewhere to rest and recover, it makes that healing, and a lot of us at our house, really, it takes thinking that way, the way you articulated it, to go, oh yeah, that's why they're so linked. That's why it's so important. So Teresa, you as a trust resident and a patient, you intimately kind of know both housing and health management. What do you think is the most important, in bridging housing and healthcare together? Like, why is it important? Why do people need to keep talking about it? What do you want the audience to know?
Okay, can you hear me?
Yes.
Okay, because I don't do technology. Okay, for me, what I want people to understand is bridging housing and healthcare together. See, housing and healthcare, being that I lived on the street for so long, housing, okay, having housing is great if you're healthy, okay, but if you're not healthy, and okay, and you don't have nowhere to go, you have a tendency to give up, okay? So why should I go see a doctor? Hey, I ain't got, I didn't myself. I didn't understand that I had Hep C. I didn't understand that I had mental health issues, okay? Until I really didn't recognize that I was in my addiction, okay? Until I had given up and recognized that I was in my addiction, and then I said I was tired of that, okay? Somebody walked up to me and said, hey, do you want to see a doctor? What do I need a doctor for? And then I met one of the doctors from the Christian Health Center. Okay, and I started talking to him, and he said, maybe you'd like to see me a couple times a month. What's wrong with me? Okay, and then I came to the Christian Health Center and was told that I had Hep C. Well, maybe you need to go over here. And I went over there, and I got the medicine, and I beat Hep C. Now, so far, I have beat Hep C. I got my mental health issues under, well, I ain't going to say under control, but hey, I got a few marbles back in the box. And I'm slowly getting my life and my health back together. Okay, my addiction problem is under control. This month, July, I'm celebrating 15 years of sobriety. Okay, and by having health care and housing is the only way it was able to happen, because being in housing, I'm able to focus on going to meetings, going to doctors, taking medication, because guess what? I know where my medicine box is. Oh, wow. I don't have a reason not to make an appointment, because my calendar on the wall says I have an appointment. And so whatever memory problems I have, I can write them down. See, mental health and housing and healthcare work together hand in hand. And if you're meeting up with, especially in the downtown area, because you're dealing with people who have mental health challenges, okay, who don't even know they have challenges. I didn't know I had mental health issues. When the doctor told me, I was like, who are you calling crazy? You know, and he didn't even say I was crazy, but still the same, you know. People don't even understand they have health issues. I didn't know what Hep C was. I didn't know I had a liver problem. I had a mass on my liver the size of a quarter. Now it's gone. Okay? And it's only because of healthcare and housing. By doing this, I live today for a reason and a purpose, and that is to get people off of the street and to get them into healthy housing. And that is why we have healthcare and housing. Skid Row Housing Trust and the Christian Health Center combined are what's working. So maybe I've overtalked, but I do when it comes to a passion like I have. Anything else?
No, well, not yet, but
Okay.
yeah. But as always, like appreciated, always love your stories and your candor, because it really just puts things in a perspective, and it's real. You know, sometimes when people hear, you know, myself talk, or even, you know, Dr. Abdishoo talk or Shannon talk, they understand, but it doesn't like emotionally resonate or connect until someone like you speaks. So very much appreciate that. You know, all the time.
What you mean, someone like me?
So that you can just really kind of, you know, share your stories and have people understand that it's, if you keep focusing on things, they can be successful too. You know, if they, you know, you are a success story and you can help them through your stories of it's possible for them to be successful as well. So it's very, very motivational.
Thank you.
So, Shannon, going to you just very quickly, you know, there's a stat out there that 8% of people experiencing homelessness identifies having a primary doctor, so they have one, but only 20% of that 8% really see those doctors, and not on a regular basis, you know, either. So can you kind of help outline what the health risks are associated with experiencing homelessness, and why it's so important, you know, for the Skid Row community and communities like Skid Row to have doctors and to use them?
Yes, thank you so much for having me on the panel today, and thank you to Skid Row Housing Trust, and so honored to be on the panel with Teresa and Dr. Lisa. Can you all hear me okay? Mm-hmm. Okay, perfect. So yes, I think this question is really excellent, because I really believe the link between getting access, having the services, you know, within an accessible area with a familiar, safe space, but also then being able to link those services, access those services and be linked to those services is really, really important. And I think really what we find, and I can speak particularly from a street medicine lens, because I'm actually a street medicine medical provider. Right now, what we see is for our neighbors who are experiencing homelessness, oftentimes just being exposed to the elements, right? So whether that's the weather, whether that's harsh conditions, whether that's trauma, whether that's violence in the community, all those items can really impact health, whether that's mental health, physical health, emotional health. So those are some things that I see firsthand, and I think our community members who are experiencing homelessness face very often on a very regular basis. And then, of course, just like what Teresa said, those with chronic illnesses, whether that's high blood pressure, a heart condition, diabetes, even Hep C or HIV, that can be managed with medications. If there is not a safe place to store medications, for example, then those conditions can really worsen. And we find a lot of our unhoused neighbors can experience significant heart disease or significant high blood pressure events, or just worsening of their symptoms, that of course can lead to complications down the line. And so I think really being able to access medical services, whether you're housed or unhoused, all of us need to access medical care, right? And I think being able to access those in a way that's safe, trauma-informed, that makes one feel comfortable and familiar is so important because of the adverse risks that basically can come down the line as our unhoused neighbors don't have access to medications, to just even to get a regular checkup, even to find preventative screenings, right? So if you're a woman over age 50, we want you to get your mammogram and get colon cancer screening and things like that. And again, if you don't have access to these services, then you're now at risk for missing a potential cancer, right? And so again, these are just these things that all of us need to have access for. And I think it's really important for our Skid Row community and also for those who are experiencing homelessness to really be at the forefront for them.
Yeah, you make a really good point on something that you said, because I think when people hear about, clinics or communities or support, they immediately go to like an emergency, right? Like there's a situation, an incident, an event, and there's emergency needs, immediately. And people forget, on the positive side, ongoing just health support, like, just ongoing, health and medical support. And then on the challenging side, what you said, a chronic issue, like, because there's always the jump to the emergency or the crisis, but things maybe don't have to become a crisis, if you're managing the medical situation that all of you identified. So I think sometimes that escapes audience when we're talking to them, when we're talking about like, centers and clinics and what have you, and they're like, oh, this is great, you can manage the crisis. It's like, no, we want to manage living and lifestyle and health and wellness, as well. So kudos to, again, all of you for doing that. Dr. Lisa, you've often communicated that health risks are higher in this community and in communities like Skid Row. And kind of piggybacking a little bit what Shannon was saying is, what services does Joshua House provide? And then what are some of the services that you can share with the audience that are like most often used?
Yeah, so at our Joshua House Clinic, we the most common service that we provide is medical care. Just by volume, that's the biggest thing that we do. And that definitely includes ongoing disease management. So just being that primary care medical home for someone with diabetes or hypertension or HIV, hepatitis C, just, numerous conditions. It also includes preventive care, so cancer screenings and other types of screenings. And then also the urgent walk-in types of needs that are addressed. And so all of that is sort of under a primary care medical. And then dentistry is another major service that we offer, and it's growing in the new building because we've gone from 4 chairs in our old building to 8 chairs in the new building. So we're going to be growing that, which is really exciting. And that includes everything from cleanings, deep cleanings, x-rays, fillings, as well as a lot of extractions and denture work, which oftentimes is needed. And even though we do a little bit more medical care than dental, dental is often that most pressing need that actually brings people through our doors. And then sometimes, that's the reason they came in, and then they'll get connected to medical. And we just see that over and over, because if you don't have your teeth, you can't get adequate nutrition. You also can't really go through a recovery process of, trying to get your life back or trying to get work. And so dentistry is another major one. And then mental health, we actually have about 10 licensed therapists and do a lot of individual therapy as well as group therapy and psychosocial rehab that we had launched right before the pandemic, and now it's getting back off the ground again. Substance use treatment, we do a lot in this area, both on the counseling and therapy side as well as on the medication-assisted treatment side. And then we also have optometry, where we do a lot of glasses, as well as working with people who have diabetes and other conditions where they need special retinal screenings and things like that. But obviously getting glasses is a huge factor for even just safety if you're living on the streets, and also if you're getting into housing or going through recovery, just having that be a part of your recovery to get your vision restored with glasses. And then 2 more things: pharmacy. We have an on-site pharmacy, and then we also have what I'll lump together as social services and care coordination. We do this in a few different ways through a few different special programs, but basically having staff on site that help with transportation, food, linking people to temporary and hopefully permanent housing. So we have staff that do that, and some of those same staff also do our outreach into the community. And Shannon will talk a little bit more about this. I could also list street medicine as a different category, although it kind of intersects with some of the other areas, but Shannon will talk about that more, I think, in a little bit.
Dr. Lisa, if you had a wish list for something more like awareness or support or anything, like is there anything that you would want this audience to know or this audience to talk on your behalf to say, you know, help us with, or we'd like more of, or whatever it is? Like, how could this audience help you?
I mean, awareness is huge, and just I think for people to understand that it's critical that our communities have access to healthcare, and that it hasn't always been the case, and that we still don't have enough access, so we're still trying to grow it. And that takes all kinds of support in all kinds of different ways. So anywhere from like philanthropic support to help keep us funded so we could grow, but also advocacy. When you hear about threats to the Affordable Care Act, like those are big threats to us when those come along, or when you hear about initiatives for funding, you know, the Medi-Cal program at the state level, those are critical for us too. So you know, definitely people can get involved in advocacy on many levels and supporting our work in different levels. And then I think we just like people to know that there's hope, and if they can spread the word, because I think so often when people that I'm in contact with in my personal life hear what I do, one of the first things I'll hear them say is like, well, it's great you're providing healthcare to people that are homeless, but don't they just want to stay homeless and nothing's really ever going to change, and what you're doing isn't really going to make a difference? And I think, you know, we just want people to know, like, no, there's countless story after story of folks who have come through our doors and their lives have changed, and they've gotten not just healthy, but linked to, you know, recovery or stability, housing, and their life truly did change. So yeah, we love for those stories to be shared.
Thank you for that. And then, Teresa, you know, you are successfully, and you have this overall wellness. You know, you have the stories about it. You know, LA Christian Health Center. You know that you know Shannon and Dr. Lisa. You know, and if you could share, like what the evolution or what the process was, you know, that you went through that you would want to share when you first became housed and then you connected with the health center, you know, what that process was that made you successful, that other people could follow, like, you know, other people could do, you know, similar to you.
Okay, well, what happened for me, okay, was I was at a drop-in center and was connected with Dr. LACHC, okay? And that is how I was connected with the Christian Health Center. And I had already signed, this was way before the housing crisis had hit. I mean, it was bad then, but this is tragic, what's going on right now. And a couple of weeks later, they called me and said, Teresa, we have an apartment for you. And I was like, whoa. And he'll tell you, I drove him crazy. And he is the most calmest man there is. Okay. And he was like, calm down, calm down. It's okay. You know, I went to see him and I was like, I got an apartment. I got an apartment. And you have to understand, I was coming off of, I had 2 years sobriety, but I had 25 years of drug abuse I was coming out of. So I was still, oh my God, oh my God. And he was like, it's okay, Teresa, it's going to work out. I'm like, dude, don't you understand? And the first night I was in that apartment, the next day I had seizures, and I was like, because I was so excited that I knew my life was going to be on the path of a whole new path. And as far as ever since I've been connected with the Christian Health Center, everybody I've met, especially females, I have told them, they're like, oh, this doctor, I can't stand this. I said, you need to go over there on Winston. Where is that? You know, that dark little street over there. And they're like, oh, now that I don't go down there. I said, girl, you need to go over there. They got some good doctors over there. And I talk about the Joshua House. I didn't even know it was called the Joshua House, but I claimed the Christian Health Center because, first off, every time I went there, they prayed with me. My doctor prayed with me and always made me feel that, oh my God, it's okay. I can leave here with my angels all around me. And my life was really going to be okay. And ever since, between Skid Row Housing and Trust, I really, you know, sometimes they make me mad, they do. But I claim them because I'll go, you know, they're righteous, okay? They put it out there and they offer, hey, look it, we're going to help you out, get your life straight. Now, here it is. Now I give it to them. You know, what you do is up to you. But when you're offered something and somebody's saying, here, man, how can you refuse it? Okay? Dang. You know, Dr. Lisa, everything you do is like, Shannon, you're awesome, you know, with the street meds and everything else, because you hit the streets, okay? And when you hit the streets, you know what I'm talking about, okay? You have to have a mentality of both sides, because, you know, there's two sides to everything, you know? And the Christian Health Center deals with all of it, you know? The Christian Health Center deals with the people. It doesn't deal with just the disease or the health. It deals with the people, the souls, the pains, not the pains of the body, the pains of the heart, the pains of the mind, the pains of the spirit. They heal people, okay? They help people want to hold on to hope. Okay, when somebody helps me hold on to hope, I can't do nothing but say thank you. And when you will help me hold on to hope and not give up after I've almost destroyed everything that the good Lord gave me, man, I can't do nothing but praise you. And that's what between the Christian Health Center and Skid Row Housing Trust did. They gave me a reason to live today. They gave me a purpose. And I'm going to claim them all the way to the graveyard. Okay? Because today I have a reason to live. I have a marriage. Okay? I was nothing but a drugged out prostitute. Okay? I had never done anything for a reason but to dig in your pocket. I'd have took everything you owned. Okay? I have a reason today. I give back. I go to church. I give out food at my church. Yes, I do take all the good eggs and everything else because I get to get it first. But yeah, okay. But I'm doing things for a purpose today. I'm not taking, I'm giving. And I want the community to understand that you give people purpose and reason to want to be givers and not takers. And that's what we need to let the world know. That everybody down on Skid Row, not just the Skid Row of Los Angeles, the Skid Rows of the world. Everybody is not a taker. Okay? A lot of us are truly givers because we weren't takers in the beginning. We ended up being takers out of survival. Our true selves came out after we washed up and you helped us dust that dirt off our hearts and our souls. After we got to washing our hair and digging up underneath our fingernails and getting rid of all that grit that we had to survive because of. Because there were a lot of people trying to take our lives. And if we didn't take back, we were going to die. Okay? So that's what I'm doing now. I'm trying to give back to my community and to anybody else who wants to live today. You know? And I'll preach on and on about it. So if you don't stop me, I'll keep talking. You know. So, but I love you guys. Hey, what can I say?
Well, again, Teresa, thank you. Always, always, always thank you. Teresa pointed to a couple of things that I think the audience should hear about and should know about, from you, Shannon. Not a lot of people are familiar with street medicine teams. They kind of know the concept, but can you tell our team members listening, our audience listening, what that is, what services you provide, and how people use that?
Yeah, thanks so much, Teresa. That was a great, first of all, just powerful, powerful words. Really, really honored to hear your story. And yes, the street medicine is the unique provision of medical services, really just outside of the box. It's a really very simple definition, really meaning that we take the services that we deliver within a brick and mortar, 4 walls of the clinic, and we take those services out into the community, going to where our community members, our patients, our neighbors reside, and giving that care in the spaces that are most comfortable, most convenient, and most familiar and safe for them. And so oftentimes for our teams, we have 4 street medicine teams that operate throughout LA. We have 2 that are mainly in Skid Row and then a little bit outside of Skid Row. And really what we do is we do the fullest scope of care we can in the most safe and appropriate way out in the field. So whether that's blood draws, wound care, medication refills, essentially whatever we can carry in our backpacks and boots on the ground, get to where we need to get to deliver care to our patients that are residing in the streets. That's what we do. And essentially we want to make sure that we have an on-ramp for people if they are feeling comfortable and ready to come into the clinic to get fuller scope care. Because there's certain things we just can't do in the streets, right? And so, so we also offer that as we build trust and rapport with our patients out in the field and in the streets. We offer that on-ramp back into the clinic as well, or to the clinic for the first time. But again, never in a way that's our agenda, right? It's really whatever's most comfortable and convenient for the patient. And so I love street medicine. It's really been a joy of mine to be able to practice street medicine, especially in Skid Row. I'm mainly in Skid Row doing the work, and I've just gotten to know my patients in a new way and getting to see the context in which their health conditions sort of arise, right? So sometimes when you're in the clinic, you don't always have a sense of what are the external factors that are playing into someone's heart condition or playing into someone's HIV or whatever, right? And so being able to see that context and being able to be invited in. I mean, it's such an honor to be able to be invited into someone's space, someone's dwelling, someone's home, and their area in which they feel safe, to be able to give care to them in that setting is a true honor. And yes, you know, it has its moments, and it's, you know, it's you're exposed to the elements, and there's things you see and smell and things like that in different parts of the community ultimately, but it is truly an honor to be able to give care in that way, and then also be able to walk alongside our patients as they journey toward more and more healing. And so that's really what street medicine is this, we say, I'm sorry, my light is going off. We say in street medicine that the streets dictate the work, you know, it's not us who dictate the work. And so really that's our model and the way we do things on this through street medicine.
Shannon, thank you for that. You know, I think, you know, people understand the importance of it, but they didn't understand like how it gets deployed, how it's connected, and that I think sometimes there's a perception that, you know, the street medicine teams go out and they serve the community, but they don't have long-standing connections, which is not accurate, right? Like, you have long-standing connections with people that use your services when you're out in the field, you know, and I sometimes, you know, and just, you know, hearing conversation around that, just the misunderstanding of the service to community of what you provide, but you do see patients on a regular basis. You know, it's just not in the traditional setting that people kind of associate, you know, medical support with, you know. So on a practical level, both, you know, Dr. Lisa and Shannon, only because we're coming out of the post-pandemic world and COVID and the vaccinations, and what are some of the perspectives, reactions, information around the community getting vaccinated? You know, should they, shouldn't they? Do they have access? Do they not? You know, is there any information that you want to share with this audience to help any efforts that you have? But there was a lot of specific questions around COVID vaccinations, and is this community getting the help that it deserves and needs, and is the community embracing, you know, any support that might be delivered? So maybe Dr. Lisa, if we could start with you, and Shannon, you could weigh in, would be great.
Yeah, obviously the vaccines have been critical, and, you know, it was just a joyous moment when we were able to give our first vaccines back in, was it late January or early February, and what a game changer it's been, but it's still a long road. And actually, we're blessed that Shannon is a part of this panel, because Shannon has been our COVID response lead since the pandemic first broke out, and has just led the way. And I've been so grateful for her. So I should let her share more about her experience in this. And maybe Shannon, you can share a little bit about like those overall vaccines, you know, that we've given, but also sort of the challenges faced along the way.
Yeah, thanks so much. For sure, the COVID vaccines have been a beautiful thing in Skid Row, you know, and I want to say to your first question about sort of access and what we call vaccine saturation, right? So how much vaccine availability and access has there been in Skid Row? And I just want to commend our county, our city partners, you know, our street medicine partners, the people concerned, who've just really, you know, partnered with us and other clinics, and even other clinics in the area, JWCH, DHS, and others, who really just come together to say, you know, COVID vaccinations, it's a priority for this community. Let's do whatever we can to redirect our teams, make sure we have the staffing, make sure we get the vaccines out there. And so that's really it's been a village, it's taken a village, and it's truly been our partners, our community partners, the missions, even the park and rec services in Skid Row, all really have come together to make sure vaccines have been accessible. And I want to say, from our side, we've given over 4,000 vaccines to date total at LA Christian, and 60% of that has been for the Skid Row community. So, really, really excited that more than half of our efforts have really been centered for Skid Row, giving the Moderna vaccine and earlier on Johnson & Johnson as well. And really, what I found is, especially initially, there's been a lot of engagement for the vaccine, and it's been really the case managers and obviously the SRO partners like Skid Row Housing Trust really coming alongside to engage and encourage, dispel any myths or fears, doing vaccine town halls at the different missions, really coming together to really just give access to the vaccine and ensure people feel safe and comfortable to get vaccinated. So I think especially right now with the setting of this new Delta variant that's sort of rising up in the LA County, just ensuring that we continue to push the vaccine and get it out there for as many folks who are still unvaccinated has been really a key priority for LA Christian. And so we're still doing mobile vaccine events. We just got a new mobile van, and we're excited to utilize that to get vaccines out into areas that have not maybe gotten vaccinated yet, whether that's in Skid Row or right outside Skid Row. And then we continue to do street medicine outreach and getting people linked through street medicine back into the clinic to get vaccinated. And so, different out-of-the-box creative and efforts to ensure that our community is kept safe as we continue to kind of recover from COVID.
Yeah, thank you all for raising awareness to not just overall health and wellness and medical services, and then specifically around the COVID vaccine, just because there seems to be a success trajectory, and you all know better than myself and the audience is trajectory has to continue, right? Like otherwise it slips back, and that's concerning, so thank you for sharing that. And just to, be respectful of time and open it up for, the Q&A. If you guys had just 30 seconds to share with the audience, around medical or health and wellness or anything that you want to share with the audience, what could it be in closing remarks before we turn it over to the Q&A session? Teresa, what would you like to share with the audience around just overall health and wellness in Skid Row community?
What I would like to health and wellness for the community. I would like for people to not look down on the people in the community and look at the people in the community as if they were each other. Don't look down on each other, okay? Because remember, that could be you, okay? And treat that person the way you want to be treated, okay? If that person needs help that person. If you see somebody down and they're bleeding, don't walk past that person. Try to help that person, call if you're scared. Call 911, okay? But don't walk past, like they say, you don't walk over a body, you walk around it. So don't walk past somebody that's in pain. You don't know whose life you're saving. That life you're saving could be just the life that saves yours, And that's what I want the community, that's what I want for this country in all actuality. But I mean, I'm delusional, okay? So, hey, what can I say? Okay, but I have high hopes. I'm never going to give up on that, okay? As far as the community is concerned, I just wish that this community, we could get this community vaccinated and housed, tear down some of these tents, and not tear them down because we're going to push them back further or push them over here. We're going to tear them down because we're going to put them in buildings. We're going to put them in housing. Okay, and if they don't want the housing, then find a place where they can put their tents, you know, a safe place. Not a place that they're going to burn up and everybody says, oh, they burned up the whole community. No, we're somewhere where it can't be burned up. Let's put it like that. Okay, you know, but like I said, you know, I just want, Skid Row is my community. You know, I live here. And I've had Section 8 chances, but I'm not leaving here until we change it up. We got to change it up. Then I'll move. Okay. But until then, I can't move. I got a mission. And my mission is to change it up, you know, or be a part of the change. Okay. So there you go.
Thank you, Teresa. Shannon, what about you? What would you like to share, just like health and wellness for the community overall? What should we learn and hear from you?
Yeah, I think from my perspective, really piggybacking off what Teresa shared, I think I've been part of Skid Row and caring for the community for the last 14 years. And, you know, honestly, it's my community. I love the neighborhood of Skid Row. You know, there's a lot of misconceptions and a lot of different ideas about what Skid Row is, but ultimately it's a community of resilience. And I think that's really what has been impressed upon me over the last over a decade. And I would just say all the entities, us, you know, LA Christian, Skid Row Housing Trust, all the other service providers in the area, ultimately, I think we have a lot to learn from the community of Skid Row, our unhoused and even housed neighbors, about resilience and about compassion. And I think they've been my greatest teachers. And I'm so honored that we get to continue to partner in walking toward healing together as a community. And just wanting, if I were to have a wish list, I know you asked that earlier, is really just further coordination and collaboration with all the different service providers in the area, because ultimately we're all on the same team for the community. And so that would be my wish and my hope, and what I want to leave with today is just more and more collaboration together.
And thank you. And Dr. Lisa, same question.
Yeah, I love what Teresa and Shannon have shared, and of course, thinking along the same lines as well. You know, that there is still much healing needed in our community, but we know a lot of what works, and we do need to stay the course and keep investing in those strategies. So we do need to keep investing in healthcare, and we do need to keep investing in housing, and to have hope and to not give up. And you know, you asked me earlier about like how can people advocate, and I wanted to say too, like there's so many opportunities to get involved and to be a part of this healing, and getting to know some of our community members can really be a life-changing thing if this is something that's on your heart or on your mind. And so, you know, we just invite people to do simple things like come, you know, contact us, you know, go on our website, contact us and come take a tour. And we love to meet with community members and folks that want to get involved. And sometimes that just starts with a tour, and that can lead to things like being a volunteer. And there's a lot of different opportunities to do that. You know, it can look a lot of different ways, but you know, we encourage folks to come down and check it out and learn about those opportunities. And we think that you'll get more from it even than you give. So.
Well, I'm going to turn it over to Jet in just a couple minutes, you know, for a couple of questions, you know, but I do want to say thank you to the three of you. It's you, your strength is admirable. Your resiliency is admirable. You know, you all touched upon hope, and I know the audience knows this, but, sometimes it's very difficult to just kind of hang in there and keep just pushing it along with some of the obstacles that gets presented to women like this panel. And despite those circumstances, you guys just keep pushing it along, and you create outcomes and you create experiences and you create results. And that's just amazing work by you as leaders in the community. So thank you for that. And thank you for your time today, and I will connect with all of you soon. And I'm going to turn it over to Jet, and she's going to open it up for Q&A, but I'm honored. Thank you. And looking forward to talking to all three of you very, very shortly.
Thank you, Lee.
Thanks, Lee. And Lisa and Shannon and Teresa, thank you so much for doing this with us. Lisa, you were the very first ever external guest on this series when we launched it at the beginning of the pandemic. And it's incredibly exciting to have you here under such different circumstances today. And I never tire of hearing Teresa. And there are a couple of questions. We always wrap this meeting up with opportunities to take action. And so, the number one thing you can do to support Skid Row Housing Trust is make a direct gift. If you'd like to advocate for funding, we have a very quick form to fill out that we share that information with elected officials when we're asking them to support our work. And then most of you are probably on our mailing list, and that's how you came to be invited to this. But if you click the link on your screen, that will give you to the link to sign up, and we'd like for you to share that with your friends and family. So that's what we ask every time we gather here. And with that, I've got a couple of questions. I have one that's my own, and so since I moderate, I'm going to go first. Lisa and Shannon, when we were filming the virtual opening for 649 LACHC and Joshua House, so many people on your team were very excited and hopeful that some of your street medicine patients would have been matched into housing at 649 LACHC. And then we were all so excited to meet Fatima, and I think that you actually had other street medicine patients who've moved in. Can you talk a little bit about what that's like specifically, just to help people? I think sometimes this can be abstract, and it could not be any more concrete than it is right now. Shannon, do you want to take that one?
Yes, I can. Thanks so much, Jet. I think from my perspective, from really being able to see patients that I was caring for in the field, in the street, from their tent, and now being able to see them housed and see sort of the difference that made, not only from a health outcome perspective, but also just from their morale and their just ability to hope and dream, and even to what Teresa was saying, just about feeling safe and cared for, has just been a huge impact on my life personally, but also just from a medical standpoint, being able to see that as a practitioner has been really, really such a joy. And so again, just being able to see that transition, there's really not a lot of words to describe what that's like, to see someone going from being in such a vulnerable situation to now truly being part of a safety net, right? Being able to be cared for from a health perspective and also from a housing perspective, and being able to see them grow and heal in a new way. So that's been, really, really tremendous.
Thank you for that. And I think the next one is probably best for you, Dr. Lisa. You've just realized a 20-year-old vision with the opening of the new Joshua House Clinic. We are so excited for you again, and really want to lift up and congratulate you and your team and all of your supporters for the extraordinary work that it took to realize that vision. What's your hope for the next 20 years?
I'm getting a little freezing of my computer, so let's see. Can you hear me?
I can, yes.
Okay, good. I heard you cut out in the question, but the hope for the next 20?
Yes, I was just going on and on about how happy we are for you.
Oh, gosh. No, we're excited too, and we probably have to catch our breath a little bit before we before we even start to think about what's next. But of course, there was always a lot that we're working on at any given time. And, you know, I think we want to keep opening up access to care and finding those individuals who are falling through the cracks and who are on the margins. And I think that's just going to continue to be at the forefront. And so I think every time we have like, oh, okay, now we've opened up this new site, or now we've opened up this new building, you know, it's going to be how do we make that the best place that it can be and do the best quality services we can do, but then also how can we go out and see who's not making it in and how do we reach them? And sometimes that may lead to opening more sites, or it may lead to different types of outreach programs, but you know, that's going to continue to be at the forefront. And Shannon touched on it. I think more and more collaborations. You know, we collaborate so much, and yet when I look to the future, I just think of finding more ways to link all of the different sort of partners and service providers together for the benefit of the community members who need a more seamless system to navigate. To find the things that they need. So those are kind of like the general concepts, I think, of where we're going. And we had to laugh because like we just finished, I guess laughing and crying, we just finished this big capital project and got into this building and realized this dream. And the very same week that we got the green light to move in, a car crashed into our Boyle Heights clinic. And that clinic's been tagged by the city, and we're waiting for it to go through the process with the engineers to find out if and when we can reopen. And so, you know, who knows? Well, we're saying, well, God, what do you have next for us? Maybe we need to replace that building as well. And so it's a challenging situation, and we're in crisis mode over there. But also it puts us in a place of saying, well, okay, what does this mean? What's going to be next in Boyle Heights? So, yeah.
And then, sorry about that. The last question that we have for you is that as communities begin to acknowledge more that mental illness is one underlying condition of homelessness, what treatments should all communities focus on in the near and far future? Teresa, I feel like that's a good one for you because mental health is something you talk about so often. And then Lisa or Shannon, if you want to add to that, we'd love that too, and we can wrap up.
Okay, first off, you have to ask me that question again because I had dogs around me.
Yeah, so more communities are beginning to acknowledge that mental illness is one of the underlying conditions of homelessness. The question is what treatments or maybe interventions should all communities focus on in the near future? And since you have lived expertise, I would start with you.
Well, me, myself, I would think that okay, here we go. Okay, there my mental illness is showing. Okay, besides that, I would think, can you hear me?
Yes, we can.
Oh, okay. Number one, I would think that mental illness should be recognized not by just the homeless, but by people, period. Because more people most people think that if they hear that little voice, oh, it's just, you know, themselves talking to themselves. It might trigger, you don't know what it might trigger, okay? And mental illness is not, they say it's a big trigger with the homeless people. A lot of homeless people aren't even aware that they're mentally ill, that they're suffering from something. A lot of people that are homeless that are suffering from mental illness, it might be a woman who has suffered from abusive relationships and she ran out to get away from that. but she's suffering from PTSD, and she's so scared of any man that comes near her. And so every time a man comes near her, she panics and she freaks out. Okay? It's mental illness with the homeless is a real bad thing and needs to be recognized that everybody, and then they say everybody that's homeless is mentally ill. Everybody that's homeless isn't mentally ill. Okay? Some are suffering from depression. Okay? Just because it's a ballpark, you know. I know what I suffer from. Okay? That's why I speak about it a lot, because I didn't know about it. I didn't know I suffered from it. I have friends that didn't know they suffered from it. Okay? So it needs to be recognized that people that are homeless may be suffering from mental illness, and they don't need to be looked down upon because they have mental illness, and it can be taken care of real fast. You know, a doctor's appointment, they start seeing a doctor, and then they start seeing a doctor that they can trust, and that's the biggest thing, because you send me to a doctor and I don't like that doctor, I'm going to start suffering from deeper, darker mental illness problems, where I'm not going to get better. I'm going to get worse. And then I'm not going to my clinic appointments, period, because now I don't trust any doctors. Okay? So it's like, man, you really have to learn. People, that's what I like about the Christian Health Center, because they know how to deal with people. And they know what they're dealing with. You know?
Teresa,
yes?
Thank you so much for that. And I want to be respectful of everybody's time, and I know we've gone a little over. There's a final question, and then we can wrap up. I guess we could go to Shannon and then to Lisa. And if you'd like to add to the mental illness conversation, that's great. But there's also a question about how you navigated solutions for quarantining unhoused patients with COVID. And I know that's probably a very long answer. I remember talking to Lisa, but why don't we wrap up there?
Sure, I can chime in briefly. I know we're over time. I think just in terms of the mental illness piece, I'll just share, in addition to what Teresa shared, you know, very eloquently in terms of acknowledging, you know, the scope and the need for mental health services, is really just continuing to think creatively about how to provide mental health services in a way that's accessible and robust in our community, right? Whether that's street psychiatry, whether that's more psychiatry in general available in Skid Row, you know, further partnerships between clinics and other agencies to really create that mental health safety net, so to speak. So I think that's just what I'd share with regards to that. And then with regards to the quarantine question, so really when we had a lot of COVID positive individuals, whether they were housed or unhoused, if they didn't have a reliable way to isolate and to complete their 14-day and eventually became 10-day isolation, we would utilize the DHS and Department of Public Health isolation and quarantine hotline, and also had some direct referrals that we partnered with as well to get folks into isolation sites to complete their isolation process. So that's how we navigated that when we had a lot of COVID positive individuals, which the positivity rate has drastically decreased in the last few months.
Yeah. And Lisa, would you like to just add a final thought to wrap up today? Thank you all so much for being here. I could listen to the three of you talk really for the rest of the afternoon. We really appreciate your sharing with us.
We love talking with you guys too. And I think it is a really hopeful moment in time. There's still obviously, you know, so many challenges and so much work that still needs to be done. But yeah, reflecting back to when I was your guest, you know, more than a year ago, and then looking at where we are now, it's a blessing to have to be able to say that, you know, we're recovering from the pandemic, and that we've just 2 weeks ago moved into that new building that we were talking about for so long, and that time has really come. So you know, we're grateful for the partnership with Skid Row Housing Trust and how that's been a part of both working together on addressing COVID and you know, being together through the thick of, you know, of that pandemic, and also our partnership with Joshua House and 649 Lofts. So it's good to spend some time with you guys, and thank you for having us.
Yes, thank you.
Thanks for being here, and congratulations again. It was just such a thrill the first day I walked by and saw your doors open. We are all really thrilled for you.
Yeah.
All right, have a great day. We'll see you soon.
Thank you.
Thanks,
Take
everyone.
care.
Thank you.
All right, join us next month.
Mm-hmm.